Hi, I'm Dr. Joshua Huffman. I'm a board-certified chiropractic neurologist. I'm also a diplomate of the American Association of Integrative Medicine. I'm the author of this book, Growing Young. I own a private practice in Mounds, Minnesota called Mounds Chiropractic. In my office, we focus on working with patients who suffer from a number of different chronic neurological and metabolic disorders. Today, I'm here to talk with you about peripheral neuropathy. If you're watching this video, chances are that either you or someone you love has been diagnosed with peripheral neuropathy. Peripheral neuropathy is a condition that's characterized by numbness, tingling, burning pain in the hands and the feet, and really anywhere throughout the body. It's really a disease that, for the patients that I've worked with, it really hinders your quality of life. And unfortunately, there's very few answers and very little hope that's traditionally given to a person that's suffering from peripheral neuropathy. It's typically managed with pain medications and told that it's going to get progressively worse. What I found in my practice is that definitely does not have to be the case. We worked with many patients that have peripheral neuropathy and have seen significant changes and improvements in the quality of their life. You can watch some of their videos on the testimonial website that we have set up. Now, getting started in talking about peripheral neuropathy, it's very important that you understand a little bit of the background of what may be going on in the body. The bottom line is, when you're dealing with any type of chronic neurologic disorder, you can't just support, you can't treat peripheral neuropathy. My goal with patients in our office is to support the patient in as comprehensive manner as possible. I always tell my patients that if you have peripheral neuropathy, there's a number of things going wrong within your body before you've developed the neuropathy. We have to investigate, we have to dig deep and find the answers for what is driving your peripheral neuropathy. As far as neuropathy goes, no one person is going to be exactly the same. You have to treat the individual, you have to support the person and help bring them back to health in order to have any chance at really seeing significant change and significant improvement in the pain and the suffering that you're feeling. So how do we do this? Well, what makes our practice unique is that we specialize in working with both the neurologic and the metabolic side of care, and we're going to support you with both. So it all starts with proper lab testing. The bottom line is, most of the patients that come into our office with neuropathy, although they've been diagnosed with neuropathy, have had very little in the way of lab testing. We need to start off by running a very comprehensive metabolic panel. This is a blood panel, but it's very, very thorough. We look at blood sugar, we look at anemia. If you're anemic, you can't get oxygen into your cells, and you're literally starving your cells of one of the key nutrients that they need. Same thing with blood sugar. If your blood sugar is not in an optimal range, you're literally poisoning your tissues. And so those two are very important to look at. We have to look at your lipid panel. We have to look for any other types of infections, signs of infections that are going on in the body. And this can all be done through the metabolic panel, where we're testing your blood to basically find out the overall status of your health. In addition to the metabolic panel, we also have to run sensitivity testing. This is imperative, and this may seem counterintuitive for a person that's suffering from peripheral neuropathy. One of my biggest challenges in working with patients is helping them understand that just because the pain is in your feet doesn't mean that that's the only place that there is a problem. And so it's very, very important that we look at all of these things. So the thing with neuropathy is that many times we see that it's being driven by an abnormal immune system reaction. The bottom line with neuropathy is that inflammation can drive damage to your nerve tissue. And so if you have any underlying inflammatory response, this has to be quenched. The very first place we have to look is your immune system. Now, 70% of your immune system is in your digestive tract. So if you have any type of gut infection or food sensitivity that's driving an immune system response in your gut, creating inflammation throughout the body, this can be one of the driving factors behind your neuropathy. So we have to look at this sensitivity testing to find out if you're creating an inflammatory reaction. Just think about it. If you're eating a food that your body reacts to every time, understand, it doesn't have to cause any type of digestive complaint. Okay, you may feel like you can eat anything you want, your digestive system feels great, you don't have any issues, but it could be the thing that's driving your peripheral neuropathy. And so we have to look and find out for you if there's food intolerances, things that you're eating that are driving an inflammatory reaction. Many times, if you have these underlying food sensitivities, these can trigger autoimmune reactions within the body, which we're going to talk about in just a moment. So, common foods that we have to look at for triggers for these, we have to look at gluten, we have to look at dairy, soy, yeast, egg, corn. We have to look at these different foods because these are common reactors with our immune systems because of the way that the foods are processed. Secondly, also to do with the gut, we need to look for signs of infection in the gut. Do you have any underlying bacterial, fungus, yeast, parasitic, overgrowth in the digestive system that could again be perpetuating a chronic immune response and leading to damage of your nervous system? These are very, very common things that we find in our patient population that have to be dealt with if you're going to have any opportunity to experience relief from neuropathy. Now, like I alluded to before, the other factor we have to take into account is we have to run immune panels to find out, is your immune system what is targeting the nerve in your body? What I can tell you is in my office, the two most common causes of peripheral neuropathy that I see is number one, diabetes. Okay, if you're diabetic, again, this is a blood sugar problem. The elevated levels of blood glucose are causing damage to your nerve tissue, and that's got to be dealt with. But secondly, it's autoimmune diseases or autoimmune reactions. You see, what an autoimmune reaction is where your immune system has been triggered to the point where your immune system starts to actually attack your own body's tissues. One of the tissues that is most commonly attacked with these types of disorders is the myelin sheath, which is the wrapping around the nerve. So we have to identify to find out if you have an autoimmune reaction going on in the body that could be causing an inflammatory reaction against your nerve tissue. This could be driving the attack against the nerves and therefore causing your neuropathy. So you understand that you could do a number of things right, but if you're still eating foods, for instance, that are driving your immune system, you're going to continue to get worse. This is the approach that we take on a metabolic level to helping patients that have peripheral neuropathy. The second component we talked about earlier was that we also address the neurologic side. We have to look at the health of the nerves and we have to look at the brain. And so as a chiropractic neurologist, that's what I specialize in doing. We look and evaluate proper nerve function to find out what specific nerve fibers have been damaged. And then we also look at the brain to find out what kind of changes in the brain are we finding. Understand that if your nerves are dying in your tissues, brain tissue is very similar in structure to nerve tissue. So if you have peripheral neuropathy, chances are that you're also suffering from changes in brain function. Some of the common symptoms that are associated with changes in neurologic function in the brain would be, fatigue, depression, anxiety. You may have problems with sleeping. You may notice more brain fog, problems with memory. If you're seeing any symptoms along those lines, then it's really important that we check the brain and make sure that the brain is as healthy as possible as well. Everything that you feel in your feet, everything you feel in your hands, whether it's tingling, it's pain, it's cold, whatever it is, you actually feel that in your brain. Okay, and so you're getting a nerve impulse from your feet that's communicating up to the brain, and your brain is what is telling you what you feel. And so we have to evaluate both sides of that equation. We have to evaluate the health of the nerves, and we have to evaluate the health of the brain, and we have to support both. And so in our office, we have specialized techniques, brain-based therapy that we've developed that allows us to rehab both the nerve itself and also the brain. Now, if you're suffering from peripheral neuropathy, I don't want to go into every little detail that we could go into. The bottom line is we have to take a very comprehensive approach in helping support you. We can do that at our office. That's all that we do. We will get to the bottom of what is going on for you. Now, in order to do this, you need to come in and sit down with us and go through a process where we basically evaluate you and find out if you are a good candidate for care, if you're somebody that we can help. But in closing, I just want to ask you, think about this. How has your neuropathy affected your daily activities? What is it preventing you from being able to do that you want to be able to get back to doing? How has it affected your family? How has it affected your friends? If it is impacting your life on a day in and day out basis, you need to change something about what you're doing. Don't buy into the old habit of, I'm just going to keep doing what I've been told. It's going to get worse. You know, you can change things, but you have to change what you're doing. And that's what we bring to the table, is we're going to take a different approach than what's been offered to you, and to help support you in a whole different manner that I think really gives you your best chance at seeing drastic changes in the quality of your life. So if you're interested, investigate our site, look at the testimonial page, listen to some of the patients that have been to our office that have experienced success, and please feel free to come into our office. We would love to meet you and see what we can do to getting you back to feeling great again. Have a great day. Thanks so much for taking the time to watch this video, and God bless. Thank you.